The nerve endings in the top of the neck can also cause dizziness. Neck-related or cervicogenic dizziness is diagnosed by elimination, typically by the family medicine specialist, looking for conditions like metabolic, diabetes, neurological, cardiovascular disorders. Eliminating those, then the physio will look for the dizziness, which is accompanied by a headache, usually on one side, and also neck pain. Another option that may be a cause of the dizziness is benign positional proximal vertigo, which is a little bit different than dizziness because it's the perception of spinning, whereas typical dizziness from the neck involves an unsteadiness, like the sensation of being on a wobbly dock. So, to look for the vestibular problem, which is a BPPV, we do a test called the Dix-Hallpike. So Rhiannon will be sitting with her legs on top. She would have given me the history of the vertigo, which is a sensation of rotation when turning in bed or looking at moving objects, those sorts of triggers. So we'll have her turn her head to about 45 degrees, a little bit of a tilt. I'm going to quickly bring her back. She keeps her eyes open. I look for changes in the eyes that reflect loose crystals in the circular canals in the inner ear that are causing the dizziness. When patients present with dizziness, we want to determine if it's coming from their neck, when they also have mechanical neck pain, or if it's from some other cause. One way to differentiate the two is a test where we compare symptoms produced when the neck is straight ahead and when it's rotated to one side. So just twist your body 45 degrees there, Rhiannon, a little more. Hold that position. I'm now going to do a test to provoke some of her dizziness. Track the pen with only your eyes. So in some cases, this is going to increase her dizziness. We would get her to note a score from 0 to 10. And then we would compare that number to the dizziness that is produced when her neck is straight ahead. If her symptoms are greater with the neck turned than when looking straight ahead, then we would know that some of her dizziness is coming from her neck.
Cervicogenic dizziness involves a mismatch of sensory nerve inputs from the neck to the brain. Retraining the fine coordination of the neck joints and muscles so that they agree with information from the inner ear and eyes is key to recovery. Check out the last video in this series on various treatment options listed in this table.